meeting of the Health Plans, Benefits, and Qualification Advisory Committee for February 20th. I'd like to remind everyone that the first time they speak, could they please identify themselves so that we recognize their voice. This is Grant Ritter, the chair of the committee. Marcin, was there any public comment?
There was no public comment, Mr. Chair. Okay. But before we go further, I just like to mention that this meeting is being recorded for the minute-taking purposes, as well as posting of the recording of the proceedings on the agency's website. This meeting is also being live streamed on the Access Health CT website. So there has not been any public comment.
Okay. Could we have an attendance, a roll call?
Okay, Mr. Chair. Dr. Ritter,
here.
Chair.
Here. Yes, present.
Sean King. Mark Schaefer. Matthew Brackman. Commissioner Manisha Tutani from DPH.
Present.
Thank you. Tun Goen.
I'm on.
Thank you. Brandon Riff.
Present.
Thank you. Ellen Skinner. And Mr. Paul Lombardo from SID, subject matter expert.
Here.
Thank you.
Okay, great. Could we now get a motion to accept the meeting minutes from last time on February 5th? Some voting member, could you make such a motion?
Thank you, to motion.
Yeah. Okay. Seconded? Another voting member?
I can
second.
I believe I'm a voting member on this meeting, yes?
Yes, you are a commissioner.
Thank you.
Thank you. Thank you. Okay. Could we have any comments, changes, edits, questions? If not, could we have a roll call vote on that?
Yes, Mr. Chair.
Minutes.
Grant Ritter.
Yes. Accept. Yes.
Sean King. Mark Schaefer. Matthew Brackman. Tun Goen.
Aye.
Thank you. Brandon Riff.
Aye.
Thank you. Ellen Skinner. And Manisha Tutani.
Aye.
Thank you.
Okay, thanks. Now I'll turn the meeting over to Rebecca to give us an update on the open enrollment period.
Thank you. Rebecca McClear, the Director of Technical Operations and Analytics here with Access Health. And today I just want to give an overview of some of the points and facts and go over. Today is a portion of the larger board report that was shared. So if there's additional questions, I would point you to that report. And or we can always follow up after the call if there's anything in particular you're interested in learning about. So this first slide, I want to mention that our 11th open enrollment this year it was overwhelmingly successful. We see we have 129,000 individuals enrolled in QHP medical coverage for 2024 as of the end of open enrollment, which was on January 15th. That is the highest number of individuals at the end of an open enrollment period since 2017. So that was our third, I believe, open enrollment. So great year, lots of activity coming in through the exchange, and we're all super excited for all the work that our partners did, our outreach teams, and everyone to make sure that the residents of Connecticut were able to come in and get the coverage that they need to keep them healthy and active for the next year. I'm not going to go through all the statistics on here, but just again to point out the 129,000, our highest number. Of those, 27,393, can't forget those 3 individuals, were enrolled into the Covered Connecticut program for this year. Again, a huge success. That was an increase of 30% by the end of open enrollment. So again, very excited. Lots of outreach was done to individuals who could be eligible. Lots of information was updated for folks to become eligible for the Covered Connecticut program. Let's see. In addition, I do want to mention that our dental program, their standalone dental plan, this year this open enrollment period, we did incorporate if you recall, last year was the first year we integrated it with our HICS system to make that shopping process easier. This year, we were able to include those individuals in their dental plans in the auto or the passive renewal phase. So folks who were enrolled in 2023 dental coverage, if they remained eligible, we would renew them automatically into that same plan for their 2024 dental coverage. That we believe really helped keep our enrollment high and strong, but we also did see a 55% growth in enrollees in our dental plans this year. So again, really great news there. Great to see folks taking advantage of those plans that we have. Next slide, please, Martin. The next couple slides, I'm just going to do a little breakdown of the market share for both the medical, the QHP medical, as well as the dental, so we can see how things are looking. This one, we see that Connecticut, again, has the majority of the market share in the QHP space. Just to point out, the orange bar portion of the bar is the non-covered Connecticut portion, while the blue is folks enrolled in the covered Connecticut program. So you'll see, by and large, the majority of each carrier's enrollment is not enrolled or not eligible for the covered Connecticut program, but we do see growth in that space year over year. Thank you. And coming over to dental, we have two carriers, Anthem and Connecticut Insurance Company, Inc. And we do see Anthem has 83% of the population is the enrollees for dental chose to enroll in an Anthem plan. This is nearly relatively the same as last year's breakdown. Although overall we did see, as I said, the overall enrollment increased by 55%. So both carriers did see a good growth in their plans and their enrollment. One thing I do want to note is this year we had 904 individuals who chose to enroll in a dental plan only. That's up. We had about just over 600 last year. So an additional 300 folks or so enroll in a dental plan only. That portion of the population, we're seeing folks who have employer coverage potentially that covers medical, but it doesn't cover dental. So they're able to come in and enroll and purchase just dental coverage through Access Health. We also have a number of Medicare covered individuals who come in and purchase additional dental coverage through us. So again, that's a great opportunity, and we're seeing that portion of the enrollment grow year over year. So we're quite excited about that as well. No questions. Thank you, Marche. So now we're coming down here to the section looking at our enrollment breakdown by plans and by metal tiers. We also have, so there's lots of information on here. Don't expect everyone to read everything, and that's okay. I'm just finding my quick notes that I made on this section. As we see, historically, when we look at the majority of our enrollment, you can see is in that silver metal tier, which again, not surprising that is the folks, they can get their covered CT enrollment in the silver bucket. But we are seeing that the gold plans, they saw the largest growth year over year. So 30% growth in the gold enrollment in the gold level plans, as opposed to just shy of 13% growth year over year for silver. So we are seeing folks who are choosing to enroll in those gold plans for the richer plans or the additional benefits that those might have in the coverage. Moving down onto dental. This again, our breakdown is very similar year over year. Percentage wise, you can tell not much has changed, but again, across the board, all of the plans did see 40, 50, some even a 60% growth to get that average up there. So very strong enrollment and into our dental plans across the board. Before we move down into the next a couple of slides which can start talking about pricing and some financial components. Are there any questions on anything that that I've mentioned so far? Not, we'll continue moving right down to the next slide. So now we're getting into a little bit more of the numbers, the financial piece. Again, lots of information here to come up with. If you have questions later on, feel free to reach out to Martin and he'll forward those along. But this slide breaks down by financial assistance level. As well, we did spike out the Covered Connecticut program in particular, even though they are normally considered part of the APT CSR population. But we'll see, by and large, the household size remains relatively consistent year over year. The average age is a little bit lower this year, but our acquisition, and the other thing you'll notice is the acquisition numbers this year. So that's folks who were on Husky in 2023 and have now enrolled into a QHP plan. These numbers, if you compare them to last year, are significantly greater, and that's by and large part of the Medicaid unwind process, right? During the public health emergency, folks weren't, if they were enrolled in Husky, they were not eligible to come off. They retained their Husky coverage until the public health emergency ended. So now, over the last coming up just shy of a year, folks are now able to come off of, if they're eligible and they update their information, they will be able to come off of their Husky coverage and enroll in a QHP. So that's why we're seeing those significant numbers in that Husky acquisition bucket this year as opposed to prior years. This next section, looking at our plan selections across metal category. Again, this is something we kind of look at each year. And I do just want to point out, and I have last year's numbers pulled up offline here, but overall, the breakdowns are fairly similar year over year as far as what percentage of let's say the APT CSR band this year. 86, just over 86% of folks that fell into that band chose to enroll in a silver plan. It was 86% even last year. The percentages are fairly similar. What we do see is that this year there is no platinum plan. So that percentage of the platinum, we see mostly increased our overall gold percentage. That was 14% last year, and it's up to 17% this year. Thank you. And this is another one we spoke about a bit last year. We're looking at folks who are CSR eligible, but have chosen to enroll in a bronze or a gold plan. Remember, folks, we give them the information, their household situations. We're not sure what those are, but these folks have chosen to enroll in either a bronze or a gold plan. We do reach out to them to let them know that they may be leaving some benefits on the table, but at the end of the day, it is their choice to choose what's right for their family. Overall, the numbers have decreased slightly since last year. So it decreased overall by about 4%. So folks are we'll take a credit a little bit that some of that messaging that is going out is resonating, and that they were able to make those changes for this year. But again, we do continue to monitor this and do outreach to those consumers to make them aware and educate them on what is available to them if they are eligible for a CSR. Excuse me. Thank you, Martin. Moving down, just a quick review looking at our breakdown of our overall population. Again, the percentages are moving around a little bit, but by and large, we're still seeing just over half of our enrollment are females. We see 24%. This is a big piece that we look at, that kind of 19 to 34-year-old bucket, or those folks who they're maybe just coming into the workforce. They're just coming off their parents' plan and learning how to buy their own health insurance. So we do see 24% in that of our enrollment falls into that category, which is great. And you'll see that was part of that band, the 19 to 25-year-old grew with the age band that had the most growth in QHP this year. So those folks are really finding value and able to get that coverage. And that's great. We don't want them to have to go without because even though they are young, we still want them to have that insurance. Okay, and I believe our next slide is dental, and we're going to see very similar makeup in our dental population. We do see a little bit more. This is up a little bit higher in that young invincibles at 19 to 34. It's up to about 31%. Again, what we're seeing is folks that aren't getting dental coverage through an employer able to come here. They really are able to take advantage of that. Thank you. Looking at our breakdown household by FPL levels, again, year over year, we're seeing this shift a little downward. Folks coming in the lower end of that spectrum up to right now we have up to 175 could be eligible for covered Connecticut. So we did see some growth in that area. Again, folks coming off of Husky due to the Medicaid unwind. We have folks coming in, increased our covered Connecticut rolls significantly. So we did see a bump up in that percentage of enrollment in that lower range there. But you will see, as you can see by this, our largest percentage is in that 151 to 200. So I don't have the breakdown, unfortunately, with me right now of that 175 to 200 range, but that's a portion that is potentially on the bubble. They very minor changes in their income may report that in. They may slide down into that covered Connecticut range. So we definitely keep an eye on that and reach out to those folks and keep them on the radar. You will also see on this that we do still that 11.7% of enrollees are those that do not request financial assistance. So those are the folks that right at the beginning of the application, they don't want to be determined eligible for Medicaid or any subsidies. That number has stayed 1 or 2% relatively consistent year over year. So we're still seeing a good percentage of our enrollees come in and want to pay for that full price QHP. Looking at the monthly cost of that here, this slide talks about what their household premium is after the APTC has been applied. Excuse me. And you'll see that by and large, where we have our I don't have my percentage numbers here, but the majority of our enrollees under that 200%. This does not include the covered Connecticut subsidy amount. So the cost to the consumer themselves under that 175 would be 0. This would be the state percentage on this one. Okay, so we do have a few other breakdowns in the overall deck that look at it from a consumer post APTC and state subsidy percentage. This is just strict APTC. And again, this breaks down for our rates. They are very similar to last year after the APTC has been applied. I think we had an increase. It was a couple percentage points, or maybe 1 or 2 percentage points for the APT-CSR level, but by and large, across age bands, the rates were fairly consistent with what they were last year around that APTC. Any questions or concerns on the rate breakdowns?
Yeah.
Okay.
Hi, Rebecca. This is
Hi, Grant.
Grant.
Yeah.
What kind of situation is it where a under 19-year-old gets QHP? Are they children in a family, or that is not got a family plan, or is it? I don't know. Are they too old for CHIP? I mean, what?
Yeah. Yeah.
Sorry,
So go
Rebecca.
ahead, Susan.
This is Susan. We don't have traditional family plans like the way an employer family plan is a family plan.
Right.
So it's a family enrolls together in a plan.
That's
but
what I
the
meant. Yeah.
Premium is done by each person. So you could have, maybe you have some children in college that are on their parents' plan. So that may be it too.
Yeah. I if they were no FA, I could see it. But if they were already in low income, I would have thought they would have gotten into CHIP of some sort, Husky, whatever.
And sometimes the parents want to have the whole family enrolled in the same plan. So there are instances, because CHIP eligibility goes up to a higher FPL to 323. So there are instances where the children are not, the parents are eligible for APTC, but the kids are not. But the parents want everybody enrolled in the same plan. So they forego the APTC for the kids to put them all in the same plan together. Got
it. Okay.
Yeah, sometimes in reviewing the households, I feel like there's a different reasoning for each situation we look at. So it is.
No, we've had situations we have four people,
to group them.
4 different plans. Yeah, I've seen that.
Exactly. So
and you may. Oh, sorry, Rebecca. I was just going to say you may have a household or an enrollment where the parents are divorced and one spouse is responsible for maintaining the kids' health coverage. And that parent themselves might actually be on an employer plan and can't put the kids on the employer plan or chooses to put them on the exchange. So they buy a child-only plan for the children.
Yeah, great.
We have we have one more question.
Yeah, sorry, just one question about similar type of question, but for young adults who may age out of their parents' plans and maybe are still students, or do we see people like that in their mid-20s or somewhere in that age group?
Yes, so they would stay on their parents' plan till their 26th birthday, correct, Susan? That year, the end of that coverage.
Yes, the year they turn 26, we allow them to stay on for the whole year. So they could be on. So
I guess what I'm asking though is, let's say they're 27 or 28 and they can't be on their parents' plan anymore. Or do we see people in that age group who maybe meet financial assistance levels or are just students or something like that and purchase plans that way?
Yeah, I think we do. And I think Rebecca may have covered it on a slide. We did see an increase in younger enrollees, 19 to 34, I think, as a whole, and then 19 to 25, right, Rebecca?
Correct.
Is that right,
19
specifically?
to 25 was the largest group age band. Thank you. That we saw growth in since last year. So we certainly do, and every year we do see growth or new enrollees coming in that age group. But this year in particular, we did see a fairly significant jump compared to prior years.
Yeah, that's why I was asking that, because you had mentioned that and highlighted that. So I was just curious if that's the phenotype of person that is in that, or we may not know, but I was just curious. Yep.
Yeah, and to be honest, the way that they are in our application, in the HICS application, in that situation, they're in the household and let's say they age out, they turn 26, then the next year they would create their own application and enroll on their own. We do see, and I don't have the numbers in front of me, but we could probably pull some numbers for you if you were interested in that, to see the proportion of those new individuals who are new because they have their own application, but not new to the exchange. Because we knew about them the year before. They're just on their own application now. That is a category we don't necessarily track, but we certainly have the information. You could probably take a look at that.
Are there any other questions? Well, thank you, Rebecca. I guess I'll call for somebody to make a motion to adjourn. Very short meeting.
This is two, motion.
Thank you. Okay, seconded? Somebody? Can somebody
I
second?
can second. I can
Oh,
second
thank you.
motion.
Thank you. Okay. Merchant, could we have a roll call?
Yes, Mr. Chair, Brian Ritter,
Yes.
Sean King, Mark Schaefer, Matthew Brackman, John Goen,
Yep.
Brandon Riff,
Yes.
Helen Skinner, and Manisha Tutani.
Yes.
Okay,
Thank
we
you.
are adjourned. Thanks, everyone, and I'll see you at the special meeting when we have it.
Thanks, everybody.
Thank you.
Yep.
Thanks all.
Take care.
Bye.
Bye now.